think it's been really problematic, the mixed messaging around AstraZeneca. And if you look at the vaccine rollout statistics, the rate of increase in vaccines slowed through June, and I do think that's largely down to the mixed messaging around AstraZeneca. Supply issues, of course, are another problem, and we've seen in Victoria, for example, a decision to hold off on new vaccines in order to ensure that people who've already been vaccinated get their second shot.
Now, I'm a little bit biased when I say this, but in terms of when we look at the under 40s here in Australia, with thousands upon thousands wanting to get the AstraZeneca jab, do you think that perhaps it should just, and I know that the government is saying that, you go to your doctor, you get the vaccine if they deem it to be, approved in that respect, but do you think that with everyone, or all the other jurisdictions around the world approving the AstraZeneca vaccine, there's not really necessarily been all that many issues with it? Do you think that there's been undue fear being placed on people here in Australia regarding that vaccine in particular?
I do, unfortunately, yes. And I think, my personal view is that the federal government should have backed AstraZeneca very strongly from the very beginning, and really should have been promoting it. It is a very safe vaccine. There have been a minuscule number of severe reactions given the number of people who've been vaccinated, and it's very clearly my view that we should be encouraging everyone to get vaccinated and to take the vaccine that's available to them, regardless of whether it's AstraZeneca or Pfizer.
Hi Archie, Mandy jumping in here. Of course, here in the state of New South Wales, and particularly here in Sydney, we are in lockdown still. What percentage of the population do you think needs to be fully vaccinated in order for lockdowns to no longer occur and for restrictions to no longer occur? Because I have seen all kinds of numbers, depending on who you ask, from 30% of the population to as much as 80% of the population, which could be months and months away.
We're definitely much closer to the latter figure. It's difficult to put a precise number on it right now. There's an awful lot of work going on behind the scenes, modelers in particular, looking at the threshold coverage that you need in order to prevent local outbreaks, threshold coverage rates that you need in order to prevent overwhelming of the health system if we take the foot off the pedal with other public health measures. But it definitely will be much closer to the high figure than the low figure.